So here we go. Again, Rafael Stella, and I am a licensed and certified health plan advisor. I've been doing this since about 2012. So we've been doing this for a nice amount of time. I represent Medicare Advantage, Medicare Supplement, and prescription drug plans. Just to be clear, I do not work for Social Security, Medicare, or any government agency. I'm an independent broker. And the advantage of working with somebody like myself or my team is that we represent all the different plans in LA County. So we can definitely give you options for anything having to do with Medicare. And not only do we represent the plans, but we take great pride in educating folks. We want to make sure that people understand Medicare. It can be a completely different language. So we want to make sure that you know what you're getting into, what you're getting out of your Medicare. We do have one local office in the city of Torrance over on Hawthorne Boulevard. And soon we will have another office in the city of Hawthorne, and that will be announced in the upcoming weeks. Now, what will we cover today? Today, we will talk about original Medicare, Part A and Part B. We will talk about Medicare Advantage, Part C, Medicare Supplements, prescription drug plans, enrollment and eligibility periods, and of course, your options. This chart here shows you your options with Medicare. Okay, it shows 3 options, and these are the 3 options we're going to cover today: Medicare Advantage, Medicare Supplement, and Original Medicare. As you can see on the side where it says helps pay for hospital stays, helps pay for medical care, all these plans are supposed to cover certain amounts or certain things within routine vision, routine hearing, things of that sort. What this chart shows you is that some options are better at covering certain things than others. We will see this chart at the end of the presentation once you hear the options, so you can see the difference in between Medicare Advantage, Medicare Supplement, and Original Medicare. Now let's start with what Medicare is. Medicare is a federal health insurance program, and it's for people age 65 or older. You can also have Medicare if you're under 65, and this has something to do with disability. Okay, the U.S. government administers Medicare, and it has 4 basic parts. It has Part A and Part B. That's also known as Original Medicare, and then Part C and Part D. And these are plans offered by private companies with approved Medicare contracts. And by the end of this presentation, hopefully you have a better understanding of what each of these parts, what each of these parts is and what they cover. Now let's talk about eligibility. Who is eligible for Medicare? The most common way of getting Medicare or being eligible for Medicare is when a person turns 65. Now, if you turn 65 and you have worked in the United States for at least 10 years full time, you will get Medicare. You're eligible for Medicare. You must also be a U.S. permanent resident for 5 or more years. You can also have Medicare under 65. And this happens if you have been disabled for at least 24 months or more. Thirdly, you can also have Medicare at any age if you have end-stage renal disease, ALS, or Lou Gehrig's disease. This is what a Medicare card looks like. It is commonly known as a red, white, and blue. If you don't have Medicare yet and you're soon to get it, when you get this card, it's a little card made of cardboard. A lot of folks tell me in the community, they say, man, why is this card not something, like a credit card or something like that, right? Because now we're already in 2020. It should be already a plastic card. However, Medicare hasn't caught up to that yet, and they still send you a little cardboard card. The reason why I like to show that picture is because a lot of folks get their Medicare card automatically, specifically if they have already been receiving the Social Security benefit from maybe 63 and a half, or maybe husband or wife has been working and they're going to get Medicare through their partner. They just get the envelope. And believe it or not, a lot of folks just throw this thing away because it looks very flimsy. A lot of people say, oh, it's just junk mail, and they throw it away. That's why it's important for you to know what that Medicare card looks like. That way you know exactly if you get it in the mail, this is a very important card. Now, if you notice, it says Medicare number, número de Medicare. It's a combination of letters and numbers. About 2016, Medicare decided that they wanted to change the way that they gave Medicare ID numbers. And the reason for that is that previous to this, your Medicare number was your Social Security number followed by a letter. Now that we live in the digital age, it's easy for fraud, or let's say you lose your purse or your wallet and you have it in there, these people are going to have your Social Security number and create huge problems. Back in 2016, Medicare decided that it would be best to give everybody a brand new Medicare ID number. And if you notice on this card, it also has hospital Part A and medical Part B. And that's what we're here to talk about today. This is known as traditional Medicare. Now, the two parts of original Medicare, your Part A, it's your hospital insurance. It covers everything inside the hospital setting. So your inpatient hospitalization, your skilled nursing, home health, blood, and hospice is all covered by Part A. Okay, now your Part B is your medical insurance, your outpatient services. So anything outside of the hospital, your doctors, your specialists, any outpatient care, any durable medical equipment, lab services, preventative services, things like physicals, colonoscopies, mammograms are covered by Part B. Now, there are some costs associated with Part A. Now, if you have worked in the United States for at least 10 years, you are eligible for Part A at no premium. And that means that on a monthly basis, Part A will not cost you anything. However, if you do not meet this requirement, you can get Part A, but it would cost $458 if you're ineligible. However, having Part A premium free doesn't mean that the services are free. Okay, if you can see on this chart, hospitalization benefit, if you can see there from day 1 to day 60, they do have a deductible. So for example, if you were to go to the hospital and you only had your Part A Medicare, you would pay $1,408 for the first 60 days in the hospital. And as you can see on this chart, the more time in the hospital you spend, the more expensive it gets. Once you get past 151 days, you are responsible for 100% of the cost. So it can get very costly. Also on the skilled nursing side, if you see the chart there, the first 20 days are covered at zero, but 21 and up, you start having responsibility financially. So make sure you understand this. A lot of folks get this card and they say, well, I have insurance, I'm good to go, I'm covered. You will have no premium for that Part A, but if you do use services, you will have certain amounts that you will be responsible for. Now your Part B. Part B does have a monthly premium, okay? And this is $144.60. Now this is based on your income, and we'll talk about that on the next slide, but this is the most common premium, $144.60, okay? Now something very important to understand, that if you have Part A and Part B, now you have traditional Medicare. That means that Medicare will pay 80% of your expenses, you will pay 20% of your expenses. What I run into a lot in the community is folks that get this card, Medicare A and B. They say, well, I don't get sick too often, I'm gonna be okay with this. However, if you go to the emergency room and you only have Medicare, 20% of the bills will be your responsibility. Worst case scenario, you need an emergency surgery, you will have 20% of bills coming out of your pocket. Now, 20% of medical bills is a very scary number, especially because you don't know what that 20% is gonna entail, right? I've had experiences that I've been to the emergency room, and when I look at those bills, it's $6,000, $7,000, and I was there for just a couple of hours. So imagine if you have a hospitalization or surgery, that 20% can really turn into something serious. So make sure that you do understand that Medicare A and B is not full coverage. You will have only 80% of coverage if you keep Medicare A and B. Now, it will cover preventative services. Annual wellness visits, mammograms, colonoscopies will be covered at zero. Okay, and these are the 2020 amounts. Every year, these amounts tend to change, not too much, but it's always good to stay updated. Now, monthly premium for Part B, like I said, $144.60 is the traditional one, and it is based on your income. Now, traditionally speaking, what Medicare will do is when you initially start your Medicare, they will go ahead and tell you it's gonna be $144.60. Once they collect all the information they need from you, if you do go a little higher, for example, if you're an individual and you're not married and you file taxes for $87,000 or more, there will be an adjustment on your premium. They do that after the fact. So this chart just goes to show that if you are making a substantial amount of money as an income when you turn 65 or when you're new to Medicare, your Part B premium is going to depend on your income. Now, what does original Medicare not cover? Number one, it doesn't cover any prescription drugs, okay? It only covers you inside of the US, so if you travel or you go out of the country, you will not be covered. Anything with eye care and hearing aids and tests, it will not cover. It doesn't give you any routine chiropractic or acupuncture, and dental is not covered by original Medicare either. So A and B, they cover everything basic inside the hospital, outside the hospital, and they don't cover it in full. So it does give you coverage, but you will have expenses if you tend to use those services. Now, this is the question that I always get. I have Medicare A and B. What does this mean? Well, a few things. Medicare A and B only covers 80% of expenses. Medicare also has a rule that says that if you have A and B, you must have prescription drug coverage. So you have to get an additional plan, and you'll hear about that in a minute, okay? But it also means that you have options to choose from to help with costs that Medicare does not cover. And that's what we're here to talk about today. So what are your options? There's three basic options. Medicare Advantage plans, or Part C. That's what on TV they're calling them nowadays, right? You know, if you have Medicare, get your Part C benefits. I hear that a lot, you know, me dijeron en la tele or whatever it may be. Spanish, English, it's the same thing. Medicare supplements, which is also known as a Medigop plan. And original Medicare plus your prescription drug plan, that is also an option. And I'll tell you how you can get that. And if that's something that you want to get, it's not the most recommended situation, but it's definitely an option for you. Now I'm here to help. Again, my name is Rafael Stella. I speak Spanish. You can reach me at my email. I also have a website as well, insurancebystella.com. We have great information on there, a lot of links to applications, how to get into Medicare, how to sign up for some of these programs to get discounts on medications. It's a site that's full of information for you folks, so make sure that you can use it. And let me play a short video for you to explain a little further about what I do. Medicare can be very confusing. What does it cost? What does it cover? When can I enroll? Why go through this process alone? Let me help. Call me. So again, my name is Rafael Stella. I'm here to help. My services are no cost, no obligation. You can text me, you can email me. Make sure you contact me and we can set up a one-on-one appointment if necessary. We can do a phone call. I'm actually seeing clients in my office now, of course, with social distancing and masks and all that stuff to make you feel safe. So we'll be more than happy to help you choose your plan and maybe just talk about your situation and see what the best bet is for you. All right, so let's continue. Enrollment periods. There are very important enrollment periods that Medicare puts forth. Okay, and the very first one is your initial enrollment period. And this is when a person is going to be new to Medicare. And the initial enrollment period consists of 7 months. 3 months before your 65th birthday, the month of, and 3 months after. During this time, not only can you enroll into Medicare, but you can also choose a health plan, okay? Now, once you become Medicare eligible, you are now going to be every year at the end of the year from October to December is something called the annual enrollment period. From October 15th to December 7th, this is the time that folks can add a plan, drop a plan, or switch a plan for the new year. And you'll know it's annual enrollment period because your mailboxes will be full of stuff. All kinds of plans every single day. You'll see commercials, you'll hear them on the radio. Annual enrollment period is very important for Medicare beneficiaries. Now, a couple of years ago, Medicare came up with something called the open enrollment period. And this runs January 1st through March 31st every year. And what this period is for is, let's say, for example, you chose a plan during the annual enrollment period, October through December. Let's say you're in February and you're not really too happy with the plan that you chose. During the open enrollment period, you can change your plan one more time. So that's definitely a helpful period to have in case you're having any issues. And throughout the year, there is something called special election periods. And these are all depending on qualifying events. For example, let's say you move to another county or to another state. Let's say you lose coverage. A lot of folks, for example, now because of COVID, they lost coverage through work because they got laid off or whatever it may be. Now, because it is a special election period and they lost coverage, they can go on their Medicare now. So of course, these things, if you ever have a lapse of coverage or maybe you feel that your insurance or something's changing, give me a call. I'll help you figure out how we can help you maintain coverage. So now, what if you're turning 65 and you want to continue working? A lot of folks nowadays are working later, right? They're not retiring when they're 65. They want to work till 67, till 68 or whatever it may be. Now, you can keep your employer coverage and decline Part B. What this means is that you can actually get Part A only and not have Part B, so you won't be charged the $144.60. However, something very key. Medicare says that you're allowed to do this, but you must have comparable coverage. And what I mean by that is that when you enroll into Medicare, you can have Part A, you won't have Part B, but I always advise to check in with Social Security and Medicare to make sure that the plan that you have at work meets their requirements. I've had horror stories from folks that have waited till they're 67 or 68 because somebody at their job told them, well, you don't need Medicare because you have insurance at work. Okay, technically that's okay. However, the insurance that they have at work does not meet the requirements that Medicare has for insurance, so that you will not be penalized for declining Medicare, because there is a penalty that comes for not enrolling into Medicare at the right time. Now, you can come off your employer plan and be on a Medicare option. A lot of folks feel, well, why am I going to rock the boat? Why am I going to just change insurance if I'm going to keep working? The thing is this: when you get older and you're 65 or older, the insurance is probably one of the most expensive things that you may have, depending on where you work. A lot of folks tell me, well, I don't pay anything for my insurance because the money gets automatically deducted and they don't feel it, they don't see it, right? However, when they look at their check stubs, they're paying $300 or $400 a month, and they weren't even aware of that, okay? So there are some things to consider before making a decision of coming off an employer plan. Number one, if you have any dependents on the policy, there's a very, very strict rule that if you're the primary on that policy, let's say for example, you're working and your husband is on your policy, or your wife is on your policy, or your kids are on your policy. Since you're the primary one on the policy, if you come off, everybody comes off. A lot of times I run into situations where maybe the husband or the wife is a little younger, they're about to be 65 in a year, and when we run the comparison of how much it would cost them to get an insurance plan on their own, you're talking about going from paying for two people $300 or $400 to paying just for that one person $700. So we want to make sure that we kind of look at the comparisons. Also, how much are you paying for coverage? I'm telling you, a lot of folks don't realize how much they're paying until they look at their check stubs. And a lot of times it can be $150 to $200 every pay period. So you're talking about $400, $500 a month. Medicare can definitely be a better option, and I can help you look at all those numbers and make sense of everything. Now, enrollment periods for Medicare Part B, this kind of just goes to show you that you can come off your Medicare or your employer coverage any time of the year, and you will be eligible to get on Part B without any penalties or any issues. So anytime during the year, if you have current employer health coverage and if you're voluntary giving up the employer coverage, you can get on your Medicare without a problem. Now, again, you have insurance through work. Why would you change it? Let's go a little bit about the comparison between employer coverage and Medicare coverage. So you see there, employer coverage, you tend to have your monthly premiums, okay? When you go to the doctor, traditionally, employer coverage will have copays. Medication costs can be a little higher on employer coverage. Now, Medicare coverage, two options. Your Medicare Advantage, most plans have no premiums. So you will not pay a monthly premium to be on a Medicare Advantage plan. Most plans have no deductibles, okay? Most plans, zero copays for primary care physicians, specialists, and hospital services. Most Medicare Advantage plans will also include your prescription drug coverage. And on top of all that, they give you extra benefits like a gym membership, vision, chiropractic, transportation, worldwide emergency coverage, on and on and on. And we can talk about that in a minute. The secondary option with Medicare is also known as a Medicare supplement or a Medigop, okay? Now, these plans do have a monthly premium, but they will also offer lower out-of-pocket expenses. And then the extra benefits are also available, like gym, vision, and chiropractic are also available on these plans. And we'll talk about the differences between Medicare Advantage and Medicare Supplement. So the first option, your Medicare Advantage plans. This is a very popular option in the Medicare community, okay? Now, what is it? If you have Part A and Part B, okay, you now qualify for Part C. And these Medicare Advantage plans were created by the federal government back in 1997. And these are all run by private companies. Companies like Scan, HealthNet, Aetna, Blue Shield. There's about 13 different plans in LA County. Now, there are a couple of different types of Part C plans or Medicare Advantage plans. Most of them are HMO plans, which means that you have to have your primary care doctor refer you to specialists and hospitals and additional services within a network, okay? In LA County, there's only one PPO plan. It's not a recommended option, but they do have one. And there's also special needs plans. And what special needs plans are is there are plans for folks, for example, with chronic conditions like heart conditions or diabetes. If people have Medicare and Medi-Cal, they can also qualify for one of these special needs plans. And what these plans basically do is they're tailored for these folks. So for example, if you're on a diabetic plan, it can cover insulin a little better as far as copays are concerned. They give you a few more trips of transportation because you may go to the doctor a little bit more, things of that sort. If this is your situation, I can definitely go through it in detail with you. Now, what is your eligibility to enroll in a Medicare Advantage plan? Number one, you must have Part A and Part B. Number two, you must reside in the plan service area, in this case, LA County. No end-stage renal disease. So if you have end-stage renal disease or you're undergoing dialysis, you do not qualify for a Medicare Advantage plan. And you must enroll during a qualified enrollment period. So if you're new to Medicare, if it's going to be your initial election period, if you're lost coverage at work, call me. We'll figure those things out for your personal needs. Now, how do these plans work? Medicare Advantage plans work with a network. So they're HMOs. So you have to have a primary care doctor. That primary care doctor will refer you to specialists in hospitals within the area. You will also be provided with coordination of care. And this is something that's very key. A lot of folks say, well, I don't like HMO because I don't like to wait on referrals, and I don't like for people to tell me which doctors I can see. However, the thing is this, a high percentage of the population is already on HMOs. And what makes these HMOs tick or work is the medical group. If you're with Optum or Healthcare Partners as a medical group, this is a very, very good option. And what happens is this, being on one of these plans with one of these major medical groups, it also actually opens up the doors to their full network and also additional services. For example, they have services like nutritionists. They have services like home health if you ever need them. They can access more information, more resources for you if you're part of one of these Medicare Advantage plans than if you're not. Because the medical group offers a lot of resources, but you do have to be on one of these plans to be able to access these resources. So that's definitely advantageous for you, and it creates coordination of care. If you have a primary care doctor and he sends you to a specialist, they have to comply and enter all the information into the electronic medical records. So that way they're not asking you, well, what did your specialist tell you? All right? Because, things get lost in translation. So you want to make sure that the doctor can actually go in there and see what the specialist saw, what tests he ran, if he prescribed any medications. All those things have to be in the electronic medical records. And this coordination of care is like having a quarterback for your health. Somebody's taking care of you. Somebody's watching out for you. These plans provide that along with the medical group. Okay. Now, what does Medicare Advantage cover? They cover everything that Part A and Part B covers. So you have all your coverage for doctors, specialists, hospitals, emergency services, all under one plan. It will also give you medication coverage. So there will be copays for that depending on your medications. Most plans cover generics at zero, but we can talk about that. And then, of course, they give you added benefits. Worldwide emergency coverage if you ever travel, vision, dental, hearing aid benefit, and of course, value-added services, over-the-counter benefits, nurse lines, nutrition and wellness programs, fitness programs, and even transportation. All these vary by health plan carrier, and they all change every year. Very, very small changes, and most of the time for the better. Are there any costs for Medicare Part C? Okay, most plans have no or low deductibles. Okay, in LA County, all plans have zero premium if they're Medicare Advantage. So the only thing that you would continue to pay is your Part B premium, which is the $144.60. But to become a member of one of these plans, you will not have to pay any monthly premiums in addition to. Okay. Now, another thing that this plan does, it allows you to control the cost, okay, of anything having to do with doctors, specialists, and hospitalizations. Zero copays for doctor visits, zero copays for specialists, zero copays for hospitalization and anything that happens in the hospital setting, including hospital stays. So imagine that, being able to sit down in the beginning of the year and know that regardless of what happens throughout the calendar year in your health, you're going to have control costs. That, I think, creates a great piece for peace of mind. So definitely includes a lot of the services at zero copay. Now, Medicare Advantage key points. Number one, no monthly premiums. So you're not going to have to pay a monthly premium to be part of one of these plans. these plans are HMOs, so you will be within the network, okay? Zero copays for primary care physician, specialists, and hospitals. They will also give you prescription drug coverage, and they will also give you additional coverage like dental, worldwide emergency coverage, and over-the-counter benefits. So Medicare Advantage makes sense for a lot of folks, and this is one of the more popular choices when it comes down to Medicare beneficiaries. The next option is a Medicare supplement plan, also known as Medigop. And supplements cover the 20% that Medicare doesn't. Now, there's different types of supplements. There is certain plans that will cover everything in full, and then there's other plans that will cover partial. So it depends on which plan you have. Advantages of Medicare supplement: no referrals, no network restrictions. That means that you can go to any Medicare approved physician in the country as long if you have a Medicare supplement, okay? One key thing about a Medicare supplement plan is that during the first 6 months of eligibility, so let's say you're turning 65, for the first 6 months after you turn 65, you have something called the guaranteed issue. And what this is that you will get the lowest rate, and they're not gonna take any health questions into consideration. If you wait till you're 67, 68, when you've already had another Medicare option, a Medicare supplement will ask you health questions, and they will rate you depending on any health conditions that you may have. So if you want to get a Medicare supplement, maybe the 6 months or the guaranteed issue period is the time to look at that option. And of course, they also do value-added services. So things like dental, vision, things of that sort, they will also offer depending on the plan. Now, for a Medicare supplement or a Medigop, you must be eligible to enroll in these plans by having both Part A and Part B. Okay, now, something very key. If you have a Medicare Advantage plan, you may not buy a Medigop or a Medicare supplement. A lot of folks say, hey, well, you know what, insurance, I want it to pay for everything. So there's certain things that Medicare Advantage doesn't pay for. I'm gonna get a Medicare supplement to help me with that. It doesn't work that way. Medicare has a very strict system where if they see that you have one Medicare item or one Medicare product on your record and you sign up for another one, it will eliminate the previous one and make the new one effective. That can create a lot of problems. I see that in the community all the time. You know, they get phone calls, or you go to a health fair and they tell you, oh, you know, this plan, it will take your doctor, it'll do this, it'll do that. And people sign up. Next thing you know, their situation is a mess. They lost doctors, they lost medication coverage, all for signing a paper, not understanding what's going on. Medicare is not a cookie cutter product. So it's not that easy to just go from plan to plan. You want to make sure that you know what you're doing if you're changing plans. And you cannot have two Medicare options. You cannot have a Medicare Advantage and a supplement. It's going to be either or. So make sure that you do understand that piece. Now, there are different types of Medicare supplements. They're categorized in letters from A to N. And what these letters pretty much determines is the different costs associated with it. So usually if you get on a plan like a plan A, it probably will have a little lower monthly premium, because these plans do have monthly premiums, but it will cover less if you use services. So it's good to look at the different plans. One key thing to understand about these plans, they do not give you prescription drug coverage, which is a requirement by Medicare. So make sure that if you do go with the Medicare option, you want to make sure that you look at a prescription drug plan as well. So let's talk and see if a Medicare supplement is a good fit for you. So the key points about a Medicare supplement plan, okay? It does have a monthly premium. So you will pay the $144.60, and let's talk numbers for a minute. If you do want to go with a Medicare supplement, you will pay the $144.60, which is your Part B premium. You will pay the monthly premium for the Medicare supplement, which right now in LA County is about an average of $200. You will also have to have a prescription drug plan, which now in LA County is about $30 to $40, and copays for medication. So you're looking at a little bit more costly option. However, you know, you will have no network, so you won't be restricted to networks, okay? Copays for PCP specialists in hospitals may vary depending on the plan, okay? And they will also give you additional benefits. So understanding the fact that with Medicare Advantage, you have no premium and no copays, but you're restricted to a network. And then understanding the fact that with a supplement, you will have a monthly premium, you may have copays, you will have to get additional prescription drugs coverage. That's where the costs kind of rise a little bit. That's the key to understanding the differences between Medicare Advantage and Medicare Supplement. Now, your Medicare Part D plan. So what is this? Medicare Part D is your prescription drug plan. Okay, and these plans were established back in 2006. Now, these plans are just for prescription drugs. So let's say, for example, you want to get a Medicare supplement, you have to have a Part D plan or a prescription drug plan. If you have Medicare A and B only, and that's what you want to keep, you must have a Part D plan as well. And that's why these plans exist. Okay, these plans generally do have a standard deductible. So what they do is you will have to pay the first $435 towards medication costs before the plan starts picking up the cost and giving you lower copays. National monthly premium average is about $30 a month. And then the copayments, it's going to depend on the medications that you're taking. Now, there's something called the coverage gap or the donut hole. And this applies to any Medicare option, whether it be through Medicare Supplement, Part D, or Part C, or Medicare Advantage, okay? And every year, Medicare has something called the initial coverage limit. For 2020, it's $4,020. And what happens is this. If you're taking brand medication, this is something to be very aware of. Because if you're taking brand medication and you hit $4,020 in expenses, and that includes the cost of the medication, including your copay, your brand medication cost will go up. So we will talk about this in detail if you are taking brand medication, because there are programs that can help you with these costs. So what do Part D plans cover? Well, every plan has something called a formulary, which is a list of medications that they cover. And this will show you, that's what I do. I sit down and I look at the different plans, your list of medications, and make sure that we suggest a plan that's going to cover them. You can also get better pricing going through contracted pharmacies. A lot of these plans have preferred pharmacies and non-preferred pharmacies. It will cover diabetic supplies, things like insulin, test strips, syringes, things of that sort. Okay, and there are certain rules about the way that you can get medications under your Part D plans. For example, if you have a medication or you get a medication when you're already on a plan, but you have pretty much a history of taking that medication, that plan can give you prior authorization from a doctor, and they have to approve a medication that you're taking if you have a prior history to taking that medication. I don't know if that's clear, but there are rules to get medications regardless of what the condition or situation is under Part D. What do they not cover? They do not cover any vitamins. They do not cover any ED drugs. They do not cover any over-the-counter drugs or anything for weight loss or cosmetic purposes. So this is just strictly for prescription drugs. So you want to make sure that you don't, your fish oils, your vitamin C, vitamin D is not going to be covered by this Part D plan. Make sure that you also understand that Part D plans are only for prescription drugs and not for medical services. Low-income assistance. If, for example, medication cost is something that is just out of control for certain folks that take specific medications. For example, for my insulin users, it can be something that can be very costly for these folks. There is a program through Medicare called Extra Help with Medications. You can apply for this and they can actually help you bring down your medication costs to $8.60 regardless of the cost of medication. So that's always something that I suggest to folks, even if they're not taking any brand medications, to apply for this program. Depending on the medication, there's also state assistance as well as pharmaceutical assistance programs. Medication can be very costly for certain conditions. You want to make sure that you do have those tools to get those costs under control. Okay, now something very important to understand, and I think this is like the 90th time that I said this in the last 30 minutes, but if you have Medicare Part A and Part B, you must have Part D or prescription drug coverage, whether or not you take medications. And what's the reason for this? You have to have Part D. If not, you will get a late enrollment penalty. And what that means is that, let's say, for example, I'm running into a lot of folks in the community nowadays that are very healthy. So they say, well, why am I going to pay $30 for something that I'm not going to use? Okay, and that's understandable. I definitely understand. However, let's say if about a year or two, you have to have a prescription drug that's pretty costly. And this happens more common than I would like to admit. Now you need help from a prescription drug plan to be able to kind of afford this medication. And Medicare says, oh, guess what? You haven't had a prescription drug plan in 2 years. So we'll give you one. However, we're going to penalize you for not having one. That is a big, big issue in the community. A lot of folks don't get that prescription drug plan because they don't want to pay that premium. not understanding that if they ever do need it, is going to be something that's going to be penalized. And it's a lifetime penalty. And the penalty is 1% of the national base premium. So the national base premium for 2020 is about $30. So, and you know, they have a weird way of calculating this, but my advice is always understand if you're going to be new to Medicare, you have to have the Part D, whether you use medications or not. So please make sure you understand that piece as well. So how do you qualify for Part D? You have to have Part A and or Part B, and you must reside in the plan service area. Now this is key. Medicare Part A and or Part B. There's a lot of folks in our community that maybe, you know, they immigrated and they didn't meet the 10-year requirement of working in the United States. So they don't have enough credits to get that Part B or that Part A. Okay, so there are folks that have Part B only. They still must have a prescription drug plan, even if they don't have Part A. That is just the rule that Medicare puts forth. Now, the key points of Part D. It only covers prescription drugs and not medical services. I run into a lot of folks in the community that say, hey, well, you know what? I have a card, I have a Medicare card, and I have a little plastic card that says Medicare on it, so I think that's what I use for my doctor. However, your Medicare Part D card will say Medicare, but it's only prescription drugs. So make sure that you understand, if you already have a plan, what you have. You must have Part D coverage, whether or not you take medications, and this is very repetitious because it's very important, okay? And then does not cover over-the-counter items. So make sure that you understand this as well. All right. Now, Medicare star ratings. This is something very important. A lot of folks that I see, they say, well, you know, they show up with their mail. You know, they definitely, they come to my office and they have this stack of mail of everything that they get. Everything says 0. And they're like, well, you know what? I don't know how to choose. What makes these plans different? So let me explain what the Medicare star rating is. This is something very important. Medicare programs all get a grade every single year, and it's based on a 5-star system. And it's based on 3 very important criteria: how members rate a plan's services and care, how well doctors detect illnesses and keep members healthy, and how well a plan's members use the recommended and safe prescription medications. So when you're getting all this mail and there's all these zeros on all these promotional items and all these things, what I go to next is the star rating. The star rating is something that signifies stability in the plan, top rate services. Most of the time, if you have a plan that has a high star rating, it also has great benefits. So this is kind of how I break down my situation with my clients. You know, I ask 3 basic questions. I say, you know, where do you go to the doctor? What medications do you take? And what are you looking to get out of your plan? And when we sit down, I go and I choose the star ratings. I look at the star ratings, and if the plan matches all the criteria as far as covering medications correctly, that their doctor takes the plan and that gets them the additional benefits that they're looking for, we go based on star ratings. So star ratings is something very important when choosing a plan. Now, here goes this chart again. We've gone through Medicare Advantage, Medicare Supplement, and of course, Original Medicare. As you can see on this chart, Medicare Advantage has yes under everything. Helps you pay for hospital stays, routine vision, dental, over-the-counter worldwide coverage. The Medicare Supplement has yes under everything, including the preventative services. The other stuff, helps pay for prescription coverage? No, because you need an additional prescription drug plan. Most of the other things like the dental and the gym, the Medicare Supplement will cover, but if you pay an additional premium for most cases. Original Medicare will only help you with hospital stays, medical care, and preventative services. All the other stuff is also not covered by Original Medicare. You will have to get it in addition to. So let me help you make the right decision at the right time. You can call me to set up a one-on-one appointment. You can text me. I speak Spanish as well. You can also visit my website, insurancebystella.com, fill out an information request, and we can reach out to you and we can talk about your particular situation. So thank you for joining this meeting. Let me know if you have any questions. I'm here to help.